Hello, and welcome to this MDA Engage webinar focused on sharing with you information about virtual medical visits. My name is Elise Qualley, and I am the Director of Community Education for the Muscular Dystrophy Association. This webinar is part of MDA's Community Education Series, MDA Engage. Throughout 2020, we will be hosting a variety of disease-specific symposia, general community education seminars, and community webinars. These events are focused on providing valuable information and resources to the community. Let's review a few important items about today's webinar. We are recording this webinar for on-demand viewing. We do have all lines muted. If you have a question during the presentation or need assistance with the webinar, please leverage the Q&A and chat features. As you will see shortly, we will have time at the end of the presentation for questions from participants. Please leverage the Q&A feature located on the webinar toolbar at the bottom of your screen. You can submit questions throughout the presentation, and we may field as many of those as possible during this time. Now to the focus of today's webinar, virtual medical visits. In April, MDA conducted a community survey around COVID-19. Through that survey, we heard that 47% of you have missed medical visits during this time. With more and more medical providers offering virtual medical visits, it is important that the community continues to receive care. With the majority of the care centers within the MDA network offering virtual medical visits, we want to ensure you feel comfortable attending one of these visits and have the tools and resources to have a successful visit. This webinar today wouldn't have been possible without the support of our webinar sponsors. So I would like to say thank you to Mitsubishi Tanabe Pharma America, to the Pfizer Foundation, to Sanofi Genzyme, to Cytokinetics, and to Numotion Foundation, all for their generous support of today's program. Now let me introduce you to our presenters today. Dr. Ambereen Mehta, MPH, is an assistant clinical professor of palliative medicine in the Department of Internal Medicine. She completed her residency in internal medicine at Johns Hopkins Bayview Medical Center and her fellowship in hospice and palliative medicine at the National Institutes of Health in 2016. After fellowship, she was part of the palliative care faculty at the University of Virginia. She was recruited to UCLA in 2018, where she is part of the inpatient palliative care consult service and conducts research in neuropalliative care and education. Dr. Martina Wiedau is a neurology specialist who is the medical co-director of the Neurology Outpatient Clinic at Westwood UCLA, the director of the ALS Clinic and Research Center at UCLA, and the clinical professor in the Department of Neurology at David Geffen School of Medicine at UCLA, all located in Los Angeles, California. For the purposes of this conversation, Dr. Mehta and Dr. Wiedau will be sharing overall information around virtual medical visits. They will share examples from their institution, UCLA Health, and how they have been implementing this type of visit. Institutions may be different in their approach and technology, so as you will hear throughout this presentation, it will be important for you to confirm with your doctor prior to a virtual visit what that visit will look like and what technology needs you will need for the visit. And with that, I would like to turn the presentation over to Dr. Mehta.
Thank you, Elise and the MDA for hosting us today. And thank you to everyone who's joining us live tonight. It's really a pleasure to join you. I'm sure many of you have heard of and even participated in a virtual medical visit, but we'd like to really help clarify what exactly is a virtual visit and what can you expect during these types of visits. How are they different from a traditional in-person medical visit? And we'll go over some tips and tricks for a successful visit, and then we're really looking forward to our live question and answer session and hearing directly from you all. So there are a number of different names for virtual medical visits. Video visits, televisits, telemedicine, telehealth are some of the most common terms you'll hear. The World Health Organization defines telemedicine as healing from a distance. And so this is really referring specifically to the medical visit with your physician or other members of the medical team. Televisits are really the same as telemedicine. Then there's telehealth, and there are many different definitions, but one of them from healthit.gov, they define telehealth as the utilization of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient and professional health education, public health, and health administration. So telehealth is really, it's not a service, it's a way of improving patient care and physician education. It incorporates, as I just described, many, many different aspects that are maybe parallel to and work together with your physician, with those who are providing you actually medical care, but it can incorporate a number of different services. So it's really a little more broad in that sense. All of these can be done by video, as we're doing today, or over the telephone, but some sort of audio and visual combination is what we think of. And it's really important to know that video visits are HIPAA protected, and we'll talk a lot more about that later on. But I think it's important to really mention up front that the whole purpose of televisits is that you're protected and your health information is protected. So Dr. Wiedau and I are both seeing patients in a virtual clinic at the UCLA hospitals that we're at, both in the hospital itself and in the clinic. In the clinic, we're seeing patients in their homes. They have their caregivers there as part of their regularly scheduled medical follow-up visits. In fact, we even have our therapists, like our respiratory, physical, occupational speech therapists, also joining in for these visits to really make it a comprehensive medical session. And in the hospital, because there are new restrictions for visitors because of the coronavirus situation, we've been using video visits to see patients with coronavirus and without coronavirus who are isolated in their hospital rooms. We've been doing daily visits. We've been using iPads to connect with individuals. We're even able to have families join us while we're seeing their loved ones or with other physician specialists, like a conference call. It's been very interesting. So we've been doing a number of connections with everybody to try to keep everyone in the loop, both by video and by phone. As difficult as the coronavirus pandemic has made life, one of the benefits it has brought us is this widespread use of virtual visits. Prior to the coronavirus emergency, insurance would not allow us to see new patients with video visits. It was also really difficult to see patients with Medicare. But video visits in the hospital weren't allowed either, and video or telephone visits weren't being reimbursed, and so many people weren't doing it and weren't equipped for it. But now, out of this necessity, there are many more doctors, many more offices and hospitals are ready for video visits and updated technology. And we're actually practicing it so much more now that even the physicians are more comfortable with this type of visit. And we've had a lot of new skills developed because of it. Virtual visits are important now more than ever. In the clinic, it's really important to allow us to continue seeing patients while we're practicing distancing. It's especially helpful for our patients with neuromuscular diseases who are at high risk, not only to keep them safe, but also to allow for them to get into be seen more regularly. In the hospital, as I was talking about, it's really important for ensuring that our patients aren't isolated and that their family members are kept up to date. For the COVID pandemic, a lot of states have allowed for physicians to actually provide telehealth across the state borders in an emergency situation. So I have colleagues here in California providing telehealth visits for patients in New York. It's been an important way to provide increased medical staff in areas where folks may not have enough providers. So if you're not sure if your provider is actually offering virtual visits, one of the things to do is to call their office and ask, specifically if they're using video or telephone calls to see patients. If they aren't, it's important to ask what precautions they're taking when they're seeing patients in person. And if needed, some of the urgent care clinics are providing telemedicine that you can do as a backup alternative. If you don't have a local clinic that's offering these services, some specialty clinics like in UCLA, the neuromuscular clinics, are offering virtual visits for out-of-state patients. So you can try and see if you can be seen in a different city or in another state using virtual visits. And another option is to ask your provider or talk to your insurance about which providers are providing telehealth. So maybe for a little while you might have to switch providers if you really need to. And it's good to have many different options like this available to you. It's really important to check what's available in your institution and with your health insurance. So now that you've found a provider or a clinic and you're ready for a virtual visit, what is it actually going to be like? So televisits can be done for initial clinic visits, for follow-up visits with your primary care doctor or with a specialist. And prescriptions can actually be provided during your virtual visit. We have patients who have the need for controlled substances like narcotic pain medications. And before telemedicine, these could not be prescribed or refilled without an in-person visit. With the new laws, because of the emergency state specifically, these prescriptions can actually be done using telemedicine. And it's important to know that specifically for controlled substances, video visits are required for the initial prescription. So both by visual, you need to have a video, and audio with some kind of phone or over that video application. For refills, you can do it either using video or telephone, one or the other. We're thinking about equipment and fitting of equipment for patients, and that can unfortunately only be done partially because you need to be able to take physical measurements. So we're doing part of that at UCLA. We're doing part of that over the televisit, and then having a follow-up with in-home visits to do the physical measurements. You should check with your own institution about how they're doing this. And if you have a procedure scheduled, for example, during this coronavirus pandemic, it's important to talk to your doctor and your surgeon about whether this can be delayed or not. If it cannot be delayed, ask them about what are the precautions they're taking to minimize your risk. For some cases, they're able to minimize how long you have to stay in the hospital. For some patients, they're able to do a shorter hospital stay without needing to be admitted, doing it in an outpatient, a short stay hospital stay where they go home the same day. If you have to stay overnight, they're finding ways to really get you home safely with additional support as quickly as possible. And video visits are pretty much as long as a regular visit, usually about 30 minutes for new patients and 15 minutes for follow-up visits. Again, that'll be institution and provider and need dependent. So talk to your provider about what they're doing for that. When you log into the visit, if you're joining as an appointment with your physician, you can expect to see your physician on the screen, and then you should be able to hear them as well if all is going correctly. And if you're scheduled for a multidisciplinary visit, your visit may be sequential with each individual specialist coming on one after the other. you might stay on the same video, and then they'll tell you, okay, stay on the line, this next person will be joining next. Or you might actually see it as a conference call simultaneously while many of the specialists join at the same time. From my personal experience, in the beginning, these visits really feel a little awkward for everyone, including the providers on the flip side. But once you get things rolling, it goes really well and it flows, and I've actually had a lot of patients enjoy the visit. In fact, I've had a lot of patients and families and colleagues say that they're finding this to be a really great way of connecting with families and patients, and hopefully wanting to keep it going even after we're through this pandemic. Just this week in the hospital, I've had a lot of families tell me how much they've enjoyed being able to connect with their physicians. And I've loved being able to see my patients and their families in their homes. I had a patient show me their wall of photographs of their grandchildren, all 12 of them.
Thank you, Dr. Mehta, and thank you to everybody in the audience for joining tonight and taking the time. I'm jumping right into the technical issues and practical issues of the virtual visits. When you have a visit set up and scheduled, it is important that you talk to the clinical coordinator prior to your virtual visit. They can help you overcome any technological difficulties and log-on challenges. They will also be the people who set up the required electronic consent, which is needed. The electronic consent is you agreeing to conduct the visit via telemedicine and to be billed for it as you and your insurance would if you were coming to the clinic. So it's important to talk to the clinic coordinator prior to your visit to ensure you understand what is required. The actual technological requirements for the televisit can vary quite a bit. It may be computer, laptop, tablet, or smartphone. Again, the clinic coordinator will be able to help you determine what you need for your virtual visit. All visits can be conducted using Wi-Fi. Some patients ask if they can see their doctor using FaceTime or other frequently used apps. But your doctor should only see you via the approved technology by their clinic, because those are encrypted and safe. That helps avoiding personal patient information becoming public. There are several technical logistic items to consider. You want to talk to your doctor or clinic coordinator about alternative options to connect on video. For example, Zoom, that can also be safe if you have any questions. Skype, FaceTime, WhatsApp, and other apps are not thought to be safe. You may also want to be ready to have the ability to switch to telephone if there are technical problems with video during the visit. Sometimes audio fails, then the doctor can see you via video, but may also use an extra phone line to hear you. Ensure that you have a good connection, move close to your Wi-Fi source, and avoid moving around much during the visit to stay connected. Sometimes it happens that the video visit cannot be finished with video visit due to technical issues. In those circumstances, it is very easy for your doctor to switch you to a phone without having to reschedule you. So your video visit at that point becomes a phone visit. That's okay. I wanted to share one example of what our institution, UCLA Health, provides to patients who have a virtual medical visit. This is a multi-step process explained in one overview. I will just go briefly through it because it's just an example. Other institutions may have different workflows. Here you see that after you have scheduled your visit in step 1, you will be asked to sign up for the institution's web portal in step 2. In step 3, you are asked to download the electronic health app on your device. You will receive help with that as needed from the coordinators or other clinic personnel. After the appointment reminder in step 4, the remaining steps deal with the actual visit. In step 5, you log into the app at the day of your visit about 10 to 15 minutes before the visit starts. You click on the appointment section, your appointment will be listed, and you click that, and then your appointment will be about to begin. You will be prompted to complete a check-in, and then in step 7, you will push begin to get started. Your provider will join you when they are ready. As doctors, we try to log in as close to the appointment time as possible. Sometimes we run late and let you wait just as in clinic. That is usually due to a longer than expected patient visit earlier. In that case, please stay on the visit and do not log out. Your doctor will join even if a bit late. Your doctor can see if you are in the visit as soon as you join. The electronic web portal also sends a message to the doctor when the patient has joined. At the very beginning of the COVID crisis, when I myself was still a bit unfamiliar with the system, I had a patient who joined the visit 2 hours before the scheduled time. I worried that the patient was had the appointment time gotten wrong and would now wait for 2 hours for me to join. So I called the patient. He told me he was just practicing. He was very surprised that I knew he was on the system, and I learned the patients are working hard to make the visits a success. For the virtual visit, you want to be prepared as you would if you saw your doctor in practice. Because the video visit is not longer than an in-person visit, you want to be efficient and prepared. Have help at your side if you need it. It may be good to have someone to hold the phone or camera while the doctor is conducting a video physical examination on you. If you are having someone with you for the visit, they can also assist if technology help is needed. It is good to have your medicine bottles with you. And write out your questions in advance so you do not forget to ask important things. Share any electronic documents with your doctor in advance if you can. For example, medication lists, paperwork that requires completion, or new test results. With virtual medical visits playing such a key role right now, more and more mainstream media are producing news articles and other information to help patients understand these visits better. One on the screen is a good example. This is from NPR. With uncertainty when in-person visits may be able to happen again in large numbers, this type of visit still is important. And we think there are a lot of benefits of this type of visits. There's no commute time for patients and parking issues. Seeing the medical provider in your own space may also help your doctor understand your needs better. And providers currently are more accessible and have more chance to perform outreach to their patients. And you as the patient can take advantage of that availability.
Thanks, Dr. Wiedau. You're absolutely right on all those things. And it's important to really think about all these benefits that video visits are providing us. I'm going to come back to emphasize again that the visits are HIPAA protected, as I mentioned earlier. What that means is that your health information is protected just like it would be in person. So your doctor will take notes, and that'll go directly into your medical chart. And with your permission, your physician may even take photographs. For example, if there's a wound that you have or something that you've been documenting by photograph all along, they might do that again through the video visit, and that would also go straight into your chart. Usually the video visits are not recorded and that the video themselves are not entered into the chart, just the documentation from your physician like any other visit. In the coronavirus pandemic, the Department of Health and Human Services, which enforces the HIPAA protection regulations, have added some additional applications to use for video chats that are also privacy protected under the good faith provision because of this health emergency. So Dr. Wiedau shared the one that we're using at UCLA. And there might be other ones that are directly embedded into the medical, electronic medical system that the hospital or that your clinic is using. But there are some places that don't have those available to them. And so you might see your clinic or your hospital or provider use other applications like Apple FaceTime or Facebook Messenger, Google Hangouts. These are ones that have been specifically listed as okay to use on the Health and Human Services website. It's important to know that the other reason these applications might be utilized is because you as a patient may already have some of these applications downloaded on your phone or your iPad or your computer, and it's most easy to just continue using these applications instead of downloading something new. There are certain apps that are not safe, things like Facebook Live or an application called TikTok or Twitch. Those are public-facing interfaces and would not be able to be HIPAA protected, and so those are not allowed to be used. So although this form of communication, this video visits, may encourage us really to talk a lot less about our goals of care and advanced care planning, I am a palliative care physician. I think it's really important to emphasize that in the time of coronavirus, it's even more important to do this. It feels different, it feels awkward, it's already a difficult conversation, but we're all finding that this coronavirus pandemic is really bringing to the forefront a lot of concern, a lot of fears, a lot of discussion about death and dying, and that's very normal and very natural for all of us to be thinking about. And so I really want to emphasize that we're having these conversations even through this new mode of communication. And so just like you would going to a regular clinic visit, if that was going to be your conversation for the day or something you've had on your mind and you're not sure about, bring it up. Talk with your provider about that. Having your advanced directive with you can be really helpful, and I'm actually finding it quite nice to be able to be in the home with family members and patients who have their medical records right there. They can easily access them instead of having to remember everything they might need on the way to clinic. In fact, as Dr. Wiedau referred to earlier, we've had a lot of our patients bring their, or email us or send us their paperwork before the clinic. So advanced directives are part of that. It's really important to think about emergency plans. The implications of going to the hospital right now are different than before coronavirus. So you may end up having to go to the hospital and end up being alone. It's just another factor into thinking about this plan and what you would like. Or if you're dependent on a caregiver and they become ill, they may not be able to return to their caregiving responsibility for many weeks. So it's important to think about that and add that into your emergency planning. Some of the patients listening today are at very high risk. So having a proactive plan means you'll be able to stay in control for as long as possible, especially in a time where many things really feel out of our control. And many of those things are affecting our mental health right now. So if you're feeling isolated and alone, or you feel like something is off, be sure to talk to your family, to your provider about what you're feeling. In fact, we did a webinar a few weeks ago with MDA on how to think about some of these things, and could use that as a nice resource to direct you to. So there are still some times that you might actually have to go in for an in-person visit, procedures, treatment infusions, or if you're having symptoms and you've already been seen by a virtual visit, your provider might ask you to come into the clinic in person. So we've reviewed quite a lot of information today. In addition to this webinar, we want to leave you with some more resources that you can access for free. There's the American Academy of Family Physicians, that they have a nice article on the difference between telemedicine and telehealth. The second resource I'd like to direct you to is MDA's COVID-19 response page. MDA updates this page as new information is shared around COVID-19 and the relevance to the neuromuscular community specifically. The Department of Health and Human Services, as I referred to earlier, they have a number of resources, including more information about telehealth tools, cloth-based coverings, and links to resources from the CDC. And with that, I'll turn it back over to Elise.
All right, perfect. Thank you so much, Dr. Mehta and Dr. Wiedau. I think you shared a lot of wonderful information and what a great overview. And I know for me personally too, a lot of these things have been questions for me and my family. So I think it's just very nice to have that knowledge about what you need to know to be prepared for this type of visit and how to do one of these types of visits, because it just is so important for everyone to maintain that focus on their care. And just because you can't be in person, it doesn't mean you still can't have that connection with your medical community. So, and I loved also that you shared about the emergency plans and to be thinking about that, because I know through our COVID-19 survey as well, that was another area that came up as a pain point, quite frankly, for the community, of really that uncertainty. And I think as Dr. Mehta, I think you said it here, but also in the other webinar we did, you know, with so much out of our control, it's nice to be able to kind of focus on some of those pieces you can control. And that's definitely one of those kind of planning in advance pieces. So I'm glad you brought that up as well. So with that, I would like to open the remainder of this webinar up to all of the listeners on the other line. We would like to leverage Dr. Mehta and Dr. Wiedau's expertise and be able to answer any questions that you may have related to the concept of virtual medical visits, those types of topics. I know we've had a few questions come in already. If you have questions that you would like to pose, please feel free to chat those into the question and answer box. And you should be able to find it. It's a little icon on the bottom of your screen, kind of towards the center, and it says Q&A. And we will try and get to as many of them as possible. So feel free to leverage that as a way to connect with us. I do have, Dr. Mehta and Dr. Wiedau, some questions that have come in, so I'm going to go ahead and start with those as well. One of the first questions came up, and I think that you somewhat addressed this kind of in your presentations, but it was, what should I do if my doctor is currently not offering this type of virtual visit?
I'm happy to answer that. So if your doctor cannot provide a virtual visit, it may be useful to find another facility that can do that, because one of the reasons to do virtual visits is to avoid having you to go to an emergency room or to urgent care. So it's important, if you have something that's new or concerning, that you do find a physician who can answer these questions for you. So you can go to your specialty or even subspecialty disease physician and find someone who is either in your state, in another place, or even out of state, that you may have read about or that you can find just by Googling them, and try to see if you can set up a visit with that physician instead of having to go to an emergency room or something else.
That's a great point, Dr. Wiedau, yes. And I think other ways that folks can find providers who are doing virtual visits is through your insurance. So you can touch base with your insurance to see which providers are within your practice group that that you know are providing that. The other option is to check with your providers. If your clinic has a social worker, they may be able to also give you some information on that if they are available and have other patients who are experiencing the same situation. And lastly, there are through the physician that you're seeing normally, they may also know how to refer you to practitioners who are able to do that.
Perfect, very good. And I think another follow-up question that came up kind of based off of that How are the findings of the virtual visit communicated with my primary neurologist if I see someone out of the area?
That's a great question. I think that a couple of ways. One is in some ways, if they're still able to access, usually what they'll do is if they're able to access your medical record, then they will input it directly into your medical record and may be able to, if it's a shared platform. For example, our university uses something called Epic. And so a number of hospitals use Epic and are able to share their documents through that. And they can directly send it to your primary provider, your primary neurologist. Make sure that you ask them to route that information to that person. If they aren't in the same system, same way you would if you were for some reason having to be seen outside of your system, ask that provider directly to send it and giving them your neurologist's information. They can fax it, they can send it through a secure site, things like that.
Perfect, thank you. I think another follow-up question that came in based off what was shared. Do insurances usually cover telehealth visits for medical providers out of state, especially if we want to see a specific MDA neurologist?
So it is probably very difficult to answer the question here right now with yes or no. The insurances probably have different plans for different people, and it is probably best to check with your insurance before you set up the visit how much of that is covered. However, having said that, there is a law now in place that the state boundaries that were in place before for such visit are not in place right now. That doesn't mean automatically, though, that your insurance will cover the visit the same way it would cover in your home state or hometown.
Perfect, perfect. Thank you for sharing that. And, you know, most folks can find their insurance number on the back of their insurance card and can call and check with them, because this obviously has opened up a lot of doors in the way of this. And we're glad that they have all been adaptable to help ensure that care can continue during this time. We do have another question that came in, and it is someone who has CMT and who has had, unfortunately, multiple surgeries, has had PT appointments be canceled, also is battling stage 4 cancer. And his question really is, you know, should I remain home until this virus is no longer a threat?
So it sounds like you're unfortunately in a high-risk group, particularly with cancer treatment. So you should really, you know, follow all the safety directions and all the recommendations that are available locally, and stay at home if you are under a stay-at-home order. And if you have to go out, or if you want to go out for a fresh air and exercise, keep the safety distance. And just be really aware of the current threat. It is so hard to quantify for any specific person how big their threat is, but I think it's very important to take it seriously and not put yourself at risk.
Thank you. Another question that came in, and I'm glad this question came in because I know Dr. Mehta and Dr. Wiedau, we chatted about this a little bit as we prep for this visit. And that question is this how moving forward our clinics will be performed? And I think they're, you know, talking about this virtual medical visit. You know, is this something that you foresee kind of staying even through this after this COVID-19 pandemic?
I think there'll be a mix. I really do. Every clinic's going to be different, and every option will be different, of course. And we don't know how much of an extent it will be. But I do think that now that the technology and the reality of how to make this work has really been kind of more pervasive than ever before, I know that there's a lot of talk about trying to continue it. I think some of this is also the reality of just the healthcare system we live in with reimbursement and how those laws will change once the emergency state is over. We know that there's been a lot of reimbursement changes, which has allowed for actually some of this to be more pervasive, and that's why it has been. But even before the coronavirus, there was a lot of programs starting to get this in place, and I'll let Dr. Wiedau answer because she's been really leading that push and leading that planning, at least in our clinics at UCLA, to try to get virtual visits on the regular planning system. So I'll let her answer that. But I do know that even before all of this changed, that it was something that medicine had been heading towards.
Yes, so what had been keeping us from doing this more widely was indeed the lack of availability through insurances. So this is, of course, currently changed, but we don't know really how this is going to be in the long run. So at this time, having this positive experience with the virtual visits as an additional visit type to in-person, not as a replacement for in-person, available, a lot of doctors are already pushing our lawmakers to extend these provisions for the virtual visits indefinitely. So we do hope we will be able to offer that, particularly as a very helpful visit type for our disabled patients and patients who live far away and oftentimes travel for hours to our clinics to be seen. And that's really a hardship for a lot of our patients.
Okay, perfect. I think one of the other questions that has come in around kind of the virtual visits is around, I realize both of you do participate in research at your current area. How are virtual visits being implemented in a research setting?
So it is definitely possible to do that. The practical approach is likely that you have to come to the clinic at least once or maybe a few times during a clinical research period if you enroll. But a lot of visits can likely be done via video. As of now, even before the COVID crisis started, a lot of our clinical trials were performed partially with in-person visit and partially with telephone visit. So I do think video visits will have an important role in that setting as well and will be very easy to integrate, actually.
Okay, perfect. Thank you. One of the questions that came in is someone who missed the first part, and they were asking and wondering if whether MDA clinics will function on video. And I can go ahead and kind of share that. We do know that a large percentage of the MDA Care Center clinics have converted and are offering this virtual medical visit as an option. I would say go ahead and check with your clinic first just to make sure, and if they're not set up yet to move forward with that, they should be able to refer you to another MDA center who is set up. Another avenue that you could check with is you could always reach out to our MDA National Resource Center. They can be reached by Resource Center at mdausa.org, and they can also provide some insight to you as well. All right, it looks like there is another question here in the chat. We talked about, is this moving forward? How do I get an evaluation for a power wheelchair during a virtual visit?
That is indeed a very difficult topic. Wheelchair evaluations require physical measurements and things like that that are very hard to do virtually. So at this time, for example, in our clinic, as we perform our wheelchair evaluations in person, we have been having patients come into the clinic in person for that. And if that's not possible, or we think it's not safe for specific patients, we have been oftentimes now delaying them at least a little bit, a month or two. And if, for example, a wheelchair is needed for a patient who was previously able to walk well with a walker or other assistance, We have been utilizing the MDA loan closet much more to bridge that time until we can do a wheelchair evaluation and do all the correct measurements and things like that.
Okay, another question we got in is, I haven't been to an MDA doctor for many years and I'm now ready to see one again. My muscle strength has deteriorated over time and I feel I should get a current evaluation. Will telehealth visits be able to provide that, or should I need to visit in person for a full evaluation? As an example, can physicians measure patient strength by instructing them to lift, perform simple tasks at home?
That's a great question. You can perhaps, in this situation, get away with a video visit. I would probably, if you're really eager to get a visit right now, start at least with a video visit, because particularly strength examination and related functions can indeed be tested via video quite well. The concern would be more other parts of the exam, if they are also required for diagnosis or for evaluating you or your progression of the disease. For example, the exam of the sensory system, and then the exam also of the deep tendon reflexes, which can be very important for the neurologist to understand your diagnosis. But I have had also myself patients who opted for the video visit during the first visit, and then we had a clear enough picture to determine what's going on, and we had then a diagnosis. But I did have a couple patients too, where after the initial visit via video, I asked them to eventually come in for an in-person visit to get clarification on what's really going on. So it's, but there's a lot of flexibility in all of that.
All right, perfect. I have a couple other questions that have come in. I think one of them is around, technical difficulties. As we know, in the time of technology, it works great when it works great, but sometimes there are difficulties. And the question is, how do you as a provider handle a technical difficulty if it happens during the visit?
This is actually, we've all experienced this already, so it's been trial and error. For example, my first week of telemedicine, I couldn't get my video to work. It wasn't because the patients, on the patient side, it was on my side. So we just switched to phone calls and did our very best to kind of get as much as we could out of that video, out of that visit, and then set up a video for a follow-up on a different day at a different time. And everyone was quite understanding and very flexible. Sometimes the application for the video wasn't working, so we had to try a different one. I have had colleagues who have just spent the time they needed to help somebody. We would direct them over the phone how to set up the app, and then spend whatever time it takes to set up the application that the person needs on their side. Maybe trial a little bit, trial and error, and then spend time on the video. So we're as we've been starting up, there's definitely been glitches. We've tried to do a mix of video and phone as much as possible. Dr. Wiedau, what about on your side?
Yeah, very similar. It is though much smoother now in my clinic after the first few weeks of doing these telemedicine visits very frequently, partially or mainly even because the staff in the clinic have been now also trained and have the experience to deal with glitches. And they have really been on the forefront of working with the patients before the doctor even gets involved to make sure everything runs very smoothly. So I'm really appreciative of the staff in that respect. And the patients have also been giving us feedback that it's become much faster and easier to get into those visits now.
Perfect, perfect. Next question is, will the MDA be having more support and resources virtually for us families, not just around televisits? And I can say yes, we are quickly adapting to look at opportunities during this time and throughout. Obviously, the coronavirus has taken all of us a little bit by surprise, and we've all been kind of racing to make sure that we can meet the needs of the community. I know I mentioned we had done a COVID-19 survey to our community to kind of help inform where there are some gaps in information and needs within the community, and we definitely are leveraging that to look at what additional needs for education and resources may be in the community that we can support. I do know one of the examples that we are doing are more of these webinars so that we can stay connected with the community. We did move all of our engaged seminars and symposia, which are typically in person, to virtual, which is going to expand that audience as well for our community. But we definitely are continuing to look at opportunities during this time for our families to be supported, served, and connected as well. So thank you very much for asking that question. I think that I don't see any more questions in the chat. I do have one more question for the two of you. I was just curious about, what do you think has been probably the most surprising or biggest benefit that the two of you have seen kind of related to the opportunity for having this type of virtual visit with your patients?
I think that a lot of the patients now in my ALS clinic I see via telemedicine are much more relaxed and less stressed than when they come to clinic. They really don't have to deal with the traffic and with the drive and everything. Oftentimes my patients really tell me they get up at 4 in the morning just to make it on time for a 9 a.m. visit. So I think that has really helped with the communication, also with the, attentiveness to visits, and overall with the, I think, the benefit of a doctor visit for the patient.
I think on my side, I see a lot of patients in the hospital when I'm doing inpatient services, and it's been really amazing to connect with families in a different way than ever before, almost to the point that we're apologizing to families for calling them so much, but we now speak to them a number of times a day, and it's been really lovely to find new ways of really speaking to them and partnering with them at a whole different level, especially at this time where the coronavirus has surprised us all, and we're all kind of functioning as humans despite our roles of healthcare. And so just really connecting on that human to human level has been really rewarding for me personally.
Perfect. Well, thank you both for sharing that and for being open and being able to talk to the, answer all of the questions from the community. We greatly appreciate that. I know we tried to get to as many questions as possible during this webinar. We are planning to do kind of a companion FAQ document that's going to accompany the on-demand webinar. So we definitely will, if we weren't able to get to your questions tonight, we will do our best to get those answered through that document. So before we wrap up, though, I did want to mention that MDA has a real great blog called Strongly. And in addition to the webinar here focused on virtual medical visits tonight, we also have a letter to the community sharing insights on this topic from another one of our care center directors, Dr. Susan Apcon. So I would encourage you to visit the blog after today's webinar at mda.org/strongly. So with that, I would like to say thank you to Dr. Mehta and Dr. Wiedau for sharing all of this great information today, and for your time and preparation leading up to this webinar, as well as a lot of thanks to your institution, UCLA Health. I also would like to say thank you to Mitsubishi Tanabe Pharma America, Numotion Foundation, Cytokinetics, the Pfizer Foundation, and Sanofi Genzyme for their support of this very important program. And I also wanted to thank my behind-the-scenes colleague, Nicole Petrowski, who has been helping us run this webinar tonight. And then lastly, I would just like to say thank you to you for taking time and joining us today. We hope you found the webinar informative and helpful information. If you have any questions on this program or any other of our Engage educational programs, please visit mda.org/engage. Dr. Mehta and Dr. Wiedau, do you have any closing words you would like to share?
I would like to thank all of you too for taking the time. It's great to have this interest in this visit, and I think from the response from the number of people having registered for this, we can see that not only we as physicians think this is a beneficial type of visit, I think the patients also appreciate that they can stay in touch with their doctors this way. So for that, I thank you, and I hope you have a good evening.
The same here. Thank you so much for letting me be a part of this, for letting me speak with you all tonight. I hope this has been a helpful resource for you, and really appreciate being able to connect with folks in real life and through virtual communication. So thank you.
Well, thank you all again for joining us, and we look forward to you joining Engage events in the future. Take care.